The following exercises are to be performed on the timeline indicated prior to the exercise. If you have any pain, discontinue the exercise until you speak with your doctor, physical therapist, or athletic trainer. With your leg elevated, point your foot down as far as you can and tighten your calf. Hold 2 to 3 seconds. Pull your foot back, tightening the muscles in the front of your leg. Hold for 2 to 3 seconds and repeat. Lying with your leg straight, tighten the muscles on the top of your thigh while pushing your knee down. Try to decrease the space under your knee and the floor or whatever you are lying on. Hold for 6 to 10 seconds, relax, and repeat. Sitting or lying with your leg flexed to about 30 degrees, tighten the muscles in the back of your thigh and push your heel down and back into the floor. At the same time, tighten the muscles on top of your thigh. The object is to feel a strong contraction of your back and front thigh muscles without allowing your knee to flex. Hold for 6 to 10 seconds, relax, and repeat. Sitting or lying with your leg straight and heel propped up, relax your leg muscles and let your knee fully extend for 1 to 2 minutes. Alternately, you can lie on your stomach with your leg hanging off a bed or bench. Relax your leg and let gravity pull your knee into full extension. In this position, you may also use your uninvolved leg to push down on your involved leg to help it into extension. Sitting on a chair or at the edge of a table or bed, contract your quads so that your knee straightens, but only straighten to 45 degrees of knee extension. Hold 2 to 3 seconds, relax, and repeat. Lying on your stomach on the floor or a bed or table with your knees straight, tighten your hamstrings and pull your foot up toward your buttocks as far as you can comfortably. Hold 2 to 3 seconds, relax, and repeat. Lie on your back or in a semi-recumbent position, supported on your elbows, with your uninvolved knee flexed to about 45 degrees and your involved leg straight. Lift your involved leg up to the level of your uninvolved leg. Hold for 2 to 3 seconds, slowly lower your leg, and repeat. Keeping your toes and foot pulled back toward you will help keep your knee straight. Lying on your uninvolved side with your involved leg straight, lift your leg towards the ceiling as far as you can comfortably. Be sure to keep your hips square to the floor and ceiling, and not let your body roll or hips rotate. Hold 2 to 3 seconds, slowly lower your leg, and repeat. Lying on your involved side with your healing leg straight and uninvolved leg crossed in front or behind, raise your involved leg up toward the ceiling as far as you can. Hold 2 to 3 seconds, slowly lower your leg and repeat. Remember to keep your hips square to the floor and not let your body roll or hips rotate. Lying on your stomach with your legs straight, flex the muscles in your buttocks to extend your hip and raise your entire involved leg off the floor. Raise your leg as far as you can comfortably, hold 2 to 3 seconds, slowly lower your leg, and repeat. Hint: if you are able to perform 10 reps with your leg straight, you can start with your knee bent to 90 degrees. While lying on your stomach with your legs straight, flex your involved knee as far as you can comfortably. If you reach a sticking point or are unable to flex farther due to weakness, use your uninvolved leg to help flex your knee by using it to pull your foot toward your buttocks. Go until you feel a strong but comfortable stretch in your knee and hold for 20 to 30 seconds. Slowly straighten your legs again and repeat. In a semi-recumbent position with your legs straight, flex your knee while sliding your heel across the floor toward your buttocks. At first, you may use your hands to help pull your thigh toward you and assist you with a stretch. As this becomes easier, use only your leg and dig your heel into the floor to provide some resistance to your hamstrings. Slowly return your leg to a straight position and repeat. This exercise is beneficial for flexion range of motion while also strengthening your hamstrings. With your legs straight and muscles relaxed, hold the top and bottom of your patella with your fingertips. Gently glide it superiorly up your leg until it stops and hold for 2 to 3 seconds. Then glide it inferiorly down your leg until it stops. Hold 2 to 3 seconds and repeat. With your leg in the same position, hold the inside and outside edges of your patella with your fingertips. Gently glide your patella medially toward the inside until it stops, holding 2 to 3 seconds. Then glide it laterally toward the outside until it stops, holding 2 to 3 seconds and repeat. This may feel somewhat awkward or uncomfortable at first, but the more you practice, the easier it gets. Patellar mobility is crucial to normal knee range of motion but should not be painful. When you are able to easily glide your patella in all 4 directions, you may stop performing this exercise. Just remember to check it every few days. Standing with your weight on your uninvolved leg, contract your hamstring muscles and flex your knee so your foot moves towards your buttocks. Hold for 2 to 3 seconds, slowly lower your leg and repeat. When it becomes easy to do 3 sets of 10, add an ankle weight or elastic tubing for resistance. Stand facing a wall with your legs straight. Use a stability ball to hold you away from the wall at about a 15 to 25 degree angle. Distribute your weight evenly between your legs, contract your calf muscles, and raise up onto your toes. Hold 2 to 3 seconds, slowly lower your heels to the ground and repeat. When performing 3 sets of 10 becomes easy, shift more weight over your involved leg until you're eventually just on one leg. When this becomes easy, you may use an overhead weight. Using a stability ball involves balance, so be careful not to lose your balance, causing you to rotate on your involved leg. Take your time, concentrate on form, and progress slowly. Hint: this exercise is more challenging than it looks. Remember to stress quality of contractions over quantity. Stand on your involved leg with a slight bend in your knee and your hands just above a counter or table. Try to stand for 15 to 20 seconds without touching your hands or opposite foot down for balance. Rest for 10 to 20 seconds and repeat. When it becomes easy to balance for 20 seconds, try to perform the same exercise with your eyes open for 15 to 20 seconds, then close for 15 to 20 seconds. This is much harder than with your eyes open, so be sure to keep your hands near a counter to catch yourself if you need to. You may also use an unsteady surface to stand on, such as a pillow, a folded towel, a foam pad, or an air pillow. When this becomes easy, you may try throwing and catching a weighted object while balancing. Be careful, take your time, and remember not to pivot or rotate on your involved leg. Hint: this is used to develop your balance and can be performed while you are brushing your teeth, doing dishes, etc. Be creative, but be careful. While walking backward on a treadmill, distribute your weight evenly, dig in with your toes behind you, and try to roll as far back on your heel as possible while you are pushing off. This will help you regain extension, normalize your gait patterns, and will help you with your balance. While lying on your back with your legs straight, place your feet on a stability ball, couch arm, small chair, or ottoman if lying on the floor. Support yourself with your arms out at about 45-degree angles on the floor. Keeping your trunk muscles tight, raise your hips toward the ceiling so that your body is in a straight line. Hold this position for 10 to 15 seconds, relax, and repeat. Sitting with a foam roller, bolster, towel roll, or soccer ball under your involved knee so it's flexed at about 25 degrees, contract your quad muscles and extend your knee as if you were slowly kicking up toward the ceiling. Hold 3 to 5 seconds, relax, and repeat. Do not use more than a 5-pound ankle weight until week 6 when the weight restriction is removed. Sitting on a chair or at the edge of a table or bed, contract your quads so that your leg extends throughout the entire range of motion. Hold 2 to 3 seconds, relax, and repeat. Do not use more than 5 pounds during week 5, but you may progress as tolerated from week 6 and beyond. While sitting on the edge of a chair or bench, distribute your weight evenly between your legs and lean forward. Keeping your back straight, slowly stand from the seated position, being sure to keep your knees pointed over your toes and your back straight. Continue rising from the seated position until your knees are at about 45 degrees of flexion. Hold this position for 2 to 3 seconds, slowly lower yourself back to the bench, and repeat. Hint: be careful not to flop down as you reach the bench. Control is the key. Stand at the edge of a 4-inch step with your weight on your involved leg. With your opposite leg off the edge of the step and heel in line with your toes of your involved leg, slowly lower yourself down by flexing your involved knee. Continue until your uninvolved heel just touches the ground but is not supporting any of your body weight. Stand back up and repeat. Hint: be careful not to let your involved knee go out or rotate in. Keep your knee pointed directly over your toes. If you don't have a small step, you can use a thick book. Just be sure it's not going to slip. Begin with a stability ball in the small of your back and against the wall. Your feet should be 1 to 2 feet in front of your body. Bend your knees, keeping them pointed over your toes as if you were sliding down a wall, keeping your back straight until your knees reach 90 degrees. Hold this position for 3 to 5 seconds, return to upright position, and repeat. If your knees extend past your toes, you need to slide your feet out. This exercise can eventually be progressed to a single leg partial squat, then a single leg full squat. You may also use dumbbells to add additional resistance. There should not be pain in the front of your knee. If pain begins or persists with this exercise, decrease your resistance, decrease the amount of squat knee flexion, or decrease repetitions. Stand with your legs shoulder-width apart and feet slightly toed out with bar resting comfortable on top of your shoulders behind your neck. Hold the bar with both hands with a grip width that is comfortable and allows for maximum control of the bar. Start with your head facing forward, tighten your core muscles, and keep your back straight. Slowly lower your body by bending your knees and hips as if you were sitting down on a stool. Be sure to keep your back straight, head up, knees pointed over your toes, and weight centered between the balls of your feet and your ankles. Lower in a sitting manner until your knees reach 90 degrees flexion. Hold 1 to 2 seconds, slowly raise, and repeat. Stand with your feet shoulder-width apart, keeping your back straight and head up. Step out in front of you so that your front knee flexes to 90 degrees and your back knee lowers towards the floor. Hold this position for 1 to 2 seconds, then push off your front leg to return your body to the starting position. Rest 1 to 2 seconds and repeat with your opposite leg. Be sure to keep your front knee pointed over your toes, and it should be over your ankle when you're in the lunge position. If your knee progresses out over or past your toes, be sure to step farther out with your foot. Sit with your back flat against the backrest, feet shoulder-width apart and slightly toed out, and positioned so that the knees are flexed to 90 degrees. Push the weight away from you by extending your legs until they are straight, but not hyperextended or locked out. Hold 2 to 3 seconds, lower slowly, and repeat. While seated in the leg press machine, fully extend your legs. Drop your feet down to the bottom of the push plate so that the balls of your feet are just above the bottom edge. Keeping your knees straight but not locked out, push out against the plate and up onto your toes as far as possible. Squeeze your calf muscles and hold for 2 to 3 seconds. Slowly let the plate back toward you, but keep your knees straight until you feel a strong but comfortable stretch in your calves. Repeat. Seated with your knee joint aligned at the axis of the machine and the leg pad just above the heels, contract your hamstrings to bring your heels up towards the buttocks as far as possible. Hold for 2 to 3 seconds, slowly lower and repeat. Hint: remember to distribute your effort evenly between your legs or isolate your involved leg by reducing the resistance and performing single leg hamstring curls. Stand with a barbell resting comfortably on your back and held with a grip which allows for maximum control of the bar and comfort. Place your lead leg onto a sturdy 4 to 8 inch platform and slowly step up onto the platform. Place your trail leg onto the platform and slowly step down with the same leg you led with on the way up. Rest 1 to 2 seconds, then repeat, starting with your opposite leg. Remember to use smooth, slow movements and keep your knee pointed over your toes. Control the motion from start to finish.